Levothyroxine in women with thyroid peroxidase antibodies before conception. A synthetic thyroid hormone used as a thyroid hormone replacement drug. Brand names include levothyroid, Levoxin, Levoxyl, Synthroid, used to treat an underactive thyroid gland, hypothyroidism.
The thyroid's a gland in the front portion of the neck, and it secretes thyroid hormone. This hormone helps control metabolism throughout the body. Hypothyroidism is having an underactive thyroid, not enough thyroid hormone. Hyperthyroidism is having too much thyroid hormone. When a patient is hypothyroid, they often can gain weight, feel lethargic or tired. They can at times have some hair loss. When a patient is hyperthyroid, they can at times feel like they are losing weight. They have shakes or tremors, they have extra heartbeats or palpitations, or maybe hot flashes. The thyroid and various thyroid illnesses can dramatically affect the success of a future pregnancy or an ongoing pregnancy. Thyroid hormone is required by the developing baby during pregnancy, and if there is not enough or if there is too much thyroid hormone, this can cause harm to the baby itself. If the mother is hypothyroid, the baby itself can be at risk for other potential harm. There can be an increased risk of miscarriage early in the pregnancy, and there can also be potential damage to the developing brain in the fetus, leading to other cognitive problems or lower IQ later in life. If the mother is hyperthyroid, there can at times be a risk of miscarriage or other pregnancy harm if the levels of thyroid hormone are excessively high in the mother. The baby can also be born with signs of Graves' disease or other signs of hyperthyroidism in rare cases. It's very important that the mother contact their physician or their endocrinologist as soon as they think they could be pregnant, because the increasing demand for thyroid hormone in pregnancy occurs very early, sometimes as early as 5 or 6 weeks of pregnancy. Our research here at the Brigham and Women's Hospital has demonstrated that the requirement for thyroid hormone goes up about 40% during the course of pregnancy. This is very important because some women do not have a functioning thyroid. If they are then taking thyroid hormone as a pill, they will need to increase the dose of that pill to be adequately normal throughout the course of pregnancy. This is very important for the baby and for the developing fetus. Any patient with a thyroid illness would benefit from being in close contact with their physician or with an endocrinologist who specializes in thyroid disorders. If someone suspects that they have a thyroid disorder, they should first reach out to their primary care physician or directly to an endocrinologist to discuss the issue. This will often lead to an examination and then some blood testing to identify if indeed there is a problem that needs to be treated.
Applications in medicine. Thyroid peroxidase antibodies are associated with an increased risk of miscarriage and preterm birth, even when the thyroid function is normal. Small trials indicate that the use of levothyroxine could reduce the incidence of such adverse outcomes. Pros and cons. Hypothyroidism can sometimes cause infertility in both men and women. Levothyroxine should not be used for the treatment of infertility unless it is caused by the hypothyroidism.
Hi, I'm Dr. Mark Charles, Director of the IVF Center here in Orlando, Florida. Thyroid function is critically important for fertility as well as pregnancy health. When you have an abnormality in your thyroid, whether you have hypothyroid, which is low thyroid production, or hyperthyroid, which is elevated thyroid production, they both can affect your ability to have a baby. When your thyroid is not functioning properly, it can actually impair your ability to ovulate, reducing ovulation function, and infertility can result. So a simple blood test called TSH can monitor your thyroid and let us know if it needs treatment. Now, how does thyroid affect pregnancy? Well, we know that in both cases of elevated thyroid or low thyroid, you have increasing pregnancy complications, such as miscarriage, and even preeclampsia and death of the baby. So it is vitally important to have good thyroid control prior and during your pregnancy. During the first trimester of pregnancy, baby actually relies on the mom's thyroid production for good neurologic and cognitive development. So the earlier that any thyroid abnormality can be detected and treated, the healthier the aspects of reproduction and pregnancy. There is evidence in the medical literature that your TSH level needs to be a little bit more controlled for pregnancy purposes than when you're not trying to get pregnant. The average TSH level should be between 0.5 and 5 roughly. But when you're trying to conceive, we actually like the upper limit to be less than 2.5 because it seems as though it could reduce the risk of miscarriage. So if your level is above 2.5, even though it's normal otherwise, we would actually want to put you on some low-dose thyroid hormone. And we recommend the brand rather than generic because the brand is much more tightly controlled to give you adequate levels.
Issue applied in Ecuador. Replacement or replacement therapy when the thyroid function is decreased or completely absent. Hypothyroid, cretinism, myxedema, not toxic goiter, hypothyroidism in general. Conclusion. The use of levothyroxine in euthyroid women with thyroid peroxidase antibodies did not result in a higher rate of live birth than placebo.